cardiac anatomy. So the first thing we need to understand about cardiovascular anatomy is how the heart is oriented within the mediastinal chest, okay, within the chest. And so the first thing we need to know is that the left atrium is the most posteriorly located in our body, whereas the right ventricle is going to be the most anteriorly located. So starting with the right ventricle, that right ventricle is most commonly injured with any chest trauma or stab wounds because it's closest to that chest wall, whereas the furthest back is going to be that left atrium. Now, what we need to understand is that there can be some pathologies associated with left atrial hypertrophy, okay? So if we have an enlargement of the left atrium, we're going to impinge on the structures located near the left atrium. And it just so happens that the esophagus runs right posterior, so posteriorly to that left atrium, so right behind the left atrium. So if we have hypertrophy or enlargement of the left atrium, we're going to get impingement on that esophagus, which causes dysphagia, or we can get impingement on the left recurrent laryngeal nerve, okay, which is a branch of the vagus nerve, which can cause hoarseness. And this is known as Ortner's syndrome, okay? Very commonly tested syndrome. And one of the mechanisms that we can use to kind of visualize the heart is we can do a transthoracic or transesophageal, okay? So if we take a camera and we put it down the esophagus and we face it anteriorly, facing forward, we're going to see that left atrium because I told you that the esophagus is right behind the left atrium. So if we go down and take a camera into the esophagus and look forward, we're going to see the left atrium. And if we turn it around, we're going to see the aorta, the descending aorta, okay? So all in all, the left atrium is located posterior, right ventricle is located anterior, okay? And the way that I remember this is from posterior to anterior, it's LARV, which is larv. And it sounds like the word love, and the heart is the main symbol for love. So LARV sounds like love, larv, and that's how I remember it, posterior to anterior, okay? Moving on. The pericardium, there's not much to know about it, except for that the phrenic nerve is going to course along that pericardium on the right side of the heart, and it's going to help innervate the pericardium. So the phrenic nerve innervates the pericardium as it passes down. Next is coronary blood supply. So what we need to understand is that the coronary blood supply is composed of two main arteries, the right coronary artery and the left coronary artery. And the right coronary artery is going to supply the right side of our heart, okay, perfectly named. Same thing as the left coronary artery. The left coronary artery is going to supply the left side of our heart. Now, we need to discuss dominance before we move forward. So, majority of everyone, okay, this is the majority of people, they are right dominant. And what that means is that the posterior descending artery comes off the right coronary artery, okay? That's all that means. So dominance just means where that posterior descending artery comes off of, and that's known as the PDA. Okay. Now, if you're right dominant, the PDA comes off of the right coronary artery. If you're left dominant, the PDA is going to come off of one of the branches of the left coronary artery. Okay. So it's very simple to understand that a majority of people are right dominant. Now, the right coronary artery mainly is going to give off that PDA. Okay. Because majority of people are right dominant. And the PDA, okay, so the dominant coronary artery is going to supply the AV node. Okay. And what's important about that to understand is that in times of any infarct, okay, so if one of those vessels gets occluded, we have to look at our heart rate. If we have a decrease in the heart rate, that means that we know that the dominant coronary artery is affected, okay? Because the dominant coronary artery supplies that AV and SA node, okay? Very important. And the SA node and the AV node, SA node specifically, is going to help with the heart rate. It is the leader of the heart rate, okay? So, real quickly, once again, just an overview. The dominant coronary artery just means if the PDA is coming off of it. So if the PDA comes off the right side, then the right coronary artery is the dominant coronary artery. If the PDA comes off the left, one of the branches of the left coronary artery, that means the left coronary artery is the dominant, okay? So wherever the PDA comes off of, that is going to be the dominant coronary artery, and that will supply the SA and AV node, and that all that means is that it's going to run the heart rate, okay? It's going to be in charge of the heart rate. Okay. Now, most patients, right coronary artery supplies and gives off the PDA. The left coronary artery is going to give off two branches, the LAD okay, the left anterior descending, and the LCX, the left circumflex artery, okay? All we need to know, okay, for pathology-wise, is that the posterior medial papillary muscle is at an increased risk of infarct because it's only supplied by one artery, and it's only supplied by the PDA. Whereas, on the other hand, the anterior lateral papillary muscle is supplied by both the LAD and the LCX, so it's less likely to infarct due to the fact that there's two blood supplies. The way that I remember this is that posterior medial starts with a P, so it's only supplied by the PDA, okay? So it's only supplied by the artery that starts with the P, which is the PDA. Whereas the anterior lateral has an L in it, anterior lateral papillary muscle has an L in it, and so it's supplied by both the L arteries, the LAD and the LCX.